recording all of our meetings and posting them to our YouTube channel. So you can go back and watch those. And I can share my screen for the agenda. That works. It's not what I want.
Did Sherry and Bill make it back in?
I don't know.
You know, that's a good idea. I'm gonna stop sharing that just because, Justin, I think you might be the only one who didn't receive our documents. Let me see. Let me just shoot those over to you real quick. Justin, what is your email address?
Isaac, ISAAC @sciotodd.org.
DODD.org. Okay, awesome. Because if I share my screen, then I can't see the participants in the room here.
Hello, it's Dan Schoonover.
Hi, Dan.
Oh,
I don't know if I can get us on video or not. Oh, yeah, I can.
It's all right if you can't.
good
Oh,
old Dan the man.
Okay. Hi, Dan. Hi, Lisa.
Oh,
Hello. I'm not going to be able to be in here because I'm on shift, but I will. We
Okay.
can.
That's fine. All right, guys. Well, is Sherry and Bill back on?
I just messaged her now to see what was going on.
Okay. Travis, do you want to go ahead and just move forward with the agenda?
sure.
I'm going to.
Yeah, she says she's having trouble.
Okay,
Okay.
that's fine.
All right, I'm going to call to order the meeting for the Southern Ohio Advocacy Group for November 16th, 2021. County member roll call. Courtney, you might have to have that. I don't have the counties in front of me.
Okay, neither do I, but I think I can pull this off. Do we have Adams? Brown? Clinton?
Fayette.
Fayette, or well, no, say E-D-E-F. Yeah, Fayette, you're right. Fayette hasn't joined us in a while. Gallia. No. Highland. Jackson. Lawrence is Aaron. Meggs. Pike.
Present.
And Lakeem, is it only you today?
Actually, it's me, and I have one of my other guys. He's on his way in right now.
Awesome.
Hey, Lakeem.
Hey, how are you, Teresa?
Good. How are you? Hey, I need to get in touch with you sometime in the next few weeks.
We will. I'll send you an email today.
Okay, thanks.
Pickaway.
Present.
Travis. Courtney. I put myself in Pickaway because I really do reside in Pickaway.
Rob.
Ross. I don't see Allison. Anybody from Ross? Scioto.
Aaron's still trying to connect.
Okay, so we have Teresa. Justin, would you like to introduce yourself to the whole group then, since you are new?
Hi, my name is Justin Isaac, and I just started yesterday as an SSA at the Scioto County Board.
Welcome. We have, Teresa, I'm guessing, or if you
Yes.
haven't met her yet, you will. And Nate, Nathan, what is your exact title at Highland County?
It's Community First Coordinator.
Okay, got
Community
it.
First Coordinator, yeah.
Awesome. Let's see. And then we have
Lakeem.
Lakeem, who is SSA in Pike County.
Yes, I'm an SSA, Justin. So if you ever have any questions or anything I can help with, you can reach out to me anytime, buddy.
Appreciate it.
Thank you. And do we have anybody from Vinton County? I don't think we do. So did we get everybody? I think so. Oh,
It
wait,
looks like
Athens.
people.
Athens, sorry. Athens is Dan. And Dan, do you have some other people there with you today? Or is it just you? Hi. Okay, awesome. All right, great. Well, let's go ahead and move on with the agenda, Travis.
All right, I was looking for a pen. I apologize.
Mhm.
Do I have somebody that wants to read the minutes from the previous meeting? If not, I will.
I can always do it too, if since you're kind of doing the
Okay,
meeting.
if you want to go ahead, that's fine. I can do it. Big deal.
Okay, meeting minutes for, let's see here, what about Bill and Sam Calvin. Sam Calvin, I think, is Adams County. Okay. Hi, guys, who just joined.
Okay. I'm here now.
All right, perfect. We're just going, I'm getting ready to read the meeting
Okay.
minutes from our October 19th, 2021 meeting. It was held virtually on Zoom. The counties present were Brown, Highland, Lawrence, Pike, Pickaway, Ross, and Scioto. Agenda items, Sherry, acting president, called the meeting to order and conducted county and member roll call. We had 10 members in attendance and 2 guests with Circular Health. Their names were Tom Mahone and Jamie Carr. Travis Dressback read the September meeting minutes, and Bill Adams approved, and Travis Dressback seconded the motion. The motion passed. Sherry Adams announced no change to the treasurer's report. Guest presentation by Circular Health. They are a new innovative company providing a unique service to individuals with IDD. They helps people having difficulty use it with internet issues set up and facilitates telehealth visits at their homes or in their communities. There's no charge currently for this service. They are working on becoming a Medicaid provider. They currently have 1 traveling van as of now that is handicap accessible and equipped with a wheelchair lift. Their dispatch center will be located in Gallipolis, but will start servicing the southeast region of Ohio. Most employees are information technology experts, and you can initiate a visit by email. Their website link is there, and the full presentation can be viewed on our YouTube channel if you would like to hear more about them. Our working together for change topic was discussed. Lakeem from Pike County contacted a local hotel in Waverly. And the only thing taken into consideration when making a room handicap accessible was for a wheelchair. He feels that after talking to the hotel that it is a lack of education to the hotel chains on what is actually needed for accessibility. Travis and Pickaway found an article that was written by a woman who gives her opinions on elements needed for an accessible hotel room. And there is a link to that article. Bill and Scioto asked for the link to be shared on our Facebook page. The ADA website was reviewed, and we are able to submit complaints online to the ADA. Travis and Courtney will look more into what information we need to submit a complaint. Bill from Scioto asked the group how we can get the community to hear about all of our issues and ideas our group has. We had an idea to contact local TV channels to let them know who we are. We could also contact local newspapers with the issues that we are discussing. We talked about our transition programs, encouraged members to bring contact information for transition coordinators in their counties. Courtney shared a form with the group that shows the start of collecting this information. Co-facilitators would like to have this form finalized by the end of the year so that we can move forward with the project and supporting transition programs. Travis explained that our project will be like a mentoring program for high school students. Lakeem and Pike attended virtual synergy with a few individuals. And it was his first time in attendance and thought it was a very beneficial. He said it was a great jumpstart to the online virtual project STIR that their county will be participating in with OSDA. Future guest presentations, November is the OISP presentation. And upcoming events, People First is still every first Friday of the month at 10 a.m. All of their information can be found on their website. The link is provided. And the OACB Winter Conference is I think, first Wednesday through Friday in December. Sherry, acting president, asked for a meeting to adjourn. Travis motioned to adjourn and Bill seconded. Motion passed and the meeting ended at 12:29 p.m. And there is the link to our YouTube channel if you want to watch.
Did anyone approve of the meeting from last month?
I'll make a
You
motion.
approve
to
of the
approve
minutes?
minutes.
Bill does.
I'll second
Bill
that.
first.
Okay, Bill, and then Travis seconded.
Yeah. Okay, there is no change of the treasury report as of not right now. So who approves of the treasury report?
I haven't even included the treasurer's report, and for so long, I forget how much money we have in there. So we won't even approve that, Sherry. We'll just move on.
Okay. Our guest presentation is Ohio ISP leader, wait a minute, I'm sorry. Ohio ISP Lisa. Oh, I'm sorry if I get this name wrong.
You don't even have to try. Well, you don't even have to try, Sherry. I wouldn't. She's Lisa from DODD. That makes it easier. But I don't know, has she joined?
I have not seen her and I have not heard from her since the 5th.
But you confirmed on the 5th, right?
Yes, I did.
Did we
I
tell
don't
her?
think she's here.
Did we tell her a certain time?
I told her between 11 and 11:45 in my original email.
Right. Let's see here. We can go ahead and move on with the agenda, and then we will come back to Lisa's presentation. Hopefully,
Okay.
cross she joins.
Open issues. Working together for a change. Open discussion on individual policy level issues. Okay, we're still talking about the hotel accommodation for people with disabilities. Okay, the action is contact local hotel lodging chain to discuss accommodations for handicap accessibility.
Travis, I'll let you
Anyone have anything to say about that?
I'll let you kind of facilitate this while I'm trying to reach out to Lisa.
Huh?
Sorry, I was trying to reach out to her also, but
Okay.
go ahead, Courtney, with it.
Okay.
So we're on number 5, is that correct? Or 6, is that correct? The working together for change. Okay. Does anybody have any updates on contacting any hotels or anything? I do not, unfortunately.
I haven't, Travis. I haven't had a second to reach out. I planned on going to, there was another local hotel that we had, but I haven't made the chance to get that yet, but I will probably here in the next week or so. My individual, Bill, he's very adamant, making sure he's on top of me about getting out there to that hotel. So I will, it'll be on the agenda for this week, if not this week, early next week. So I'll have some information.
Thank you, Lakeem.
Oh, no problem.
Yeah, my schedule's been kind of crazy. I haven't had a chance to be out anywhere to talk to anybody or contact anybody myself. So we can kind of go from there. And does anybody have any comments they want to make about the hotels? Justin, can kind of let you know what we've been doing. We've been having a big discussion about hotels and how they accommodate people with disabilities and the lack of accommodations. I don't know when the last time you were in a hotel was, but or seen or talked to somebody who's with a disability that's been in a hotel and the problems they've been having. But one of the big things that the hotels tell you when it's an accessible room is there's grab bars in the bathroom. I don't know if you've ever heard that or not. You're muted, by the way. There you go.
Sorry. No, okay. So that's the
So, and we've come to realize that there's more than just people that need grab bars, in a hotel. There's lack of, automatic door openers. There's lack of people who read Braille. There's lack of, items in the hotel room that are in Braille. It's all printed material. Bed frames being wrong, bathrooms not being big enough. I went to, just to give you an example, I went to a hotel in Tennessee last year, and the railing, I couldn't even see out because the railing was in my eyesight. They could have had three sides of it blocked off or topped off with wood to make it look decorative. And it was not fun to enjoy a balcony with that kind of a site. But I've been in bathrooms where, there's no tub seat available for me to be able to sit in. And if there is a tub seat, it's usually at the far end opposite of wall of where the knobs are to turn the shower water on. So it's not easy for me to reach.
Mhm.
So we've been trying to find ways to get into hotels and talk to people that run those hotels as to what they see, versus what we see, and the changes that we would like to see made. Even with like the ADA, the Americans with Disabilities Act, it hasn't been changed since 2010. And it, like I said, it doesn't accommodate for people with all different disabilities. It's just one here and one there, you know what I mean?
Mhm.
So we've been trying to think of ways to contact the ADA or get ourselves into hotels or contact hotels to see what's going on. Why there's
And this is like a huge issue. So it was suggested to us to start reaching out to like our locally owned or state park lodges, like hotels, accommodations, and just kind of try to start small to say, what makes your rooms accessible, and just kind of that broad question. So that's kind of what we're trying to gather right now. And
Plus-
so go ahead. No, go
Plus,
ahead.
I've also noticed, Justin, that, the hotels are, depending on how many rooms are in that hotel, total, there's supposed to be a percentage of those that are actually handicap accessible. And I've come to find out that the rooms that they do have accessible, they do not have the proper enough equipment to cover each of those rooms. There's never enough tub seats, to put in there. There's never enough this, never enough that, And not all hotel rooms are made the same. Everything is completely different in each hotel.
Right.
So there needs to be one just universal design that they make for all encompassing, for everybody.
Yep. Okay, so since we don't have much on the hotel accommodations, we're going to keep that on there because that's one of the issues that we want to continue to work on through next year. But is anybody else opening the floor? Has anybody else experienced any kind of hardship in the last month or two, whether you're at home, in the community, at work? Has there been anything that you would like to see changed for a person with disabilities?
There's something that's coming up with winter time coming up and people in wheelchairs.
Oh, yeah.
The lack of sidewalks in accessible areas that are not shoveled.
Right.
For us to-
Hi.
So that's something I usually watch out for
Mhm.
during winter time is
Sound.
whether the sidewalks are
Travis,
wiped off or
that's
swept
a
or
good,
whatever.
yeah, that's a good point right there, Travis. To piggyback off of that, because with me being an SSA and I work with a lot with Pike Metropolitan and housing authorities and things of that nature, and a lot of times within their, they cover snow removal. That's part of their contracts a lot of times, but it's one of those kind of what the snow removal mean. How in depth is it? And I found that a lot of my homes, our staff are the ones that have to go out and do it, unless it's in a storm.
Right,
If it's a big storm that came in, then Metro will go out. But typically, a lot of times I found that it's put on our staff, which makes that very difficult, because if it's staff in the home that requires someone that has 24/7 or just requires a little bit monitoring, that's hard for them to get out there and do that. And then on top of it, just doing it itself, shoveling, that's not a fun task. So.
Right.
Team, can I cut you off for just a second?
No, absolutely.
Courtney, Lisa
Yep.
said she's waiting to be admitted to the room.
Yep, I admitted her. Let's go ahead, Lisa, if you don't mind. We'll just
Oh, there
finish
you are.
this. We'll just finish this conversation about the sidewalks, and then we'll let Lisa present. So Travis and Lakeem, if you want to continue to kind of talk about that, then we'll
No, I didn't really. I just was piggybacking off of Travis. I thought that was a really good idea of something to look into. I am involved with our housing authority here quite often, and I reach out to them for a lot of our homes, just to specify like, hey, in this home we need a little bit more assistance. If you can kind of monitor a little bit more, and it has helped. It's definitely helped, and the staff has been appreciative of that as well. Obviously, that's one less thing that they have to worry about, especially with trying to transport someone into a car for medical appointments, because you can't figure, just because it's wintertime, our appointments don't stop, right? So all that stuff continues. So I would say maybe trying to, if you are having issues with that, depending on if you have if it's a house, a Metro house or something like that, maybe that might be an avenue of trying to reach out to them. That's kind of been successful for me. But then again, we have our other houses that are not Pike Metro. And then it's back on to just, kind of staff doing that task. And it's really no real answer to fix. I don't have an answer to fix it.
Yeah, Lakeem, who did you say was the organization that you reach out to? Metro?
So we have a Pike Metro Housing Authority, which is, they do a lot of our housing, which is a lot of our group homes, a lot of our individuals go into their homes.
Okay.
It's just a metropolitan. And I'm sure Ross has a metropolitan. I'm sure you guys use one with the housing. And we just reach out to them. They do a lot of the home repairs in the home, quick fixes and stuff like that. And then if there's, the property is obviously there. So a lot of times they're open to the idea, especially with the being our individuals, of a little bit more courtesy of going out and kind of monitoring a little bit more and assisting a little bit more with weather, obviously with snow. That's been the biggest thing for our individuals. So I've just reached out to them in the past, and they've been helpful to allow our individuals, and it prevents our individuals from having to get out there and cause themselves of getting harmed, because I do have higher functioning individuals that can get out there and shovel, but they choose not to. Like, if I had the choice, I wouldn't either. So it wouldn't, I don't blame them.
My biggest pet peeve when it comes to, the snow removal is when they do the streets. When they do and then they leave the snow pile in front of the ramp.
Yeah.
Right.
And it's never cleaned off. That's one of the biggest pet peeves I have about winter.
Yeah. And that might be something where, a simple conversation to ODOT, maybe they don't even realize it. Again, you know, if they are not employing someone with disabilities and they don't have that mind frame, you know, when they're cleaning off the roads, they may have no idea what they're doing.
They just look to get the job done. They don't look at, you know, who's it's gonna affect later on.
Yeah. All right, cool. Well, and I have no idea, and we have some SSAs on here, and Lisa, do Medicaid waivers pay for like lawn care services for some of our individuals? No. And so I'm wondering, you know, if that's something too, that like, you know, for health and safety, how do some people's yards get mowed, you know, and taken care of? Would those people be able to?
It looks like Teresa and I were disagreeing.
I know, you know, we have some independent HPC providers that will, yeah.
So you're billing HPC services to get lawn service done, right? Versus, which that's fine. That's fine. I don't care. I don't care. I don't care. However you're getting it done. I guess in particular, it's not a service that you could authorize underneath the waiver. But if you can be creative to get it done in some way, shape, or form, then I say rock on and be creative.
Got it.
Yeah.
So it could be under.
My question is that
I don't know who that is. That's
me, Nathan.
or no, but there's a lot of background noise here. I don't know who. I'm gonna mute Lisa. There it is. Okay, it's Athens County. That's all right. I got him muted.
They're
Okay.
having a party without us.
Nate, go on.
Back in our county, that we have what you call Highland Housing, and we have something we call community action. And if for individuals who receive the county board services, you know, we have operation departments who will, like, if there's a problem at the house, let's say there's a water leak or the roof needs replaced and stuff like that, it is their job to check it out. They would get a work request, work orders, because we are contracted through community action as well, the county board, to provide maintenance for individuals who lived in the house, you know, and they go making sure that the water leaks were fixed. So whatever maintenance be done. I would assume that maybe they could get the yard mowed as well too, like get the lawn service, right? It's the whole property that, you know, getting taken care of.
Right.
Right?
And Nathan,
I don't know. What's that?
Nathan, was that an authority like Lakeem was talking about, or who was that again?
We have a contract called Highland County Highland Housing, and community action is involved as well too.
Okay.
And we're contracted through those people and stuff, and if something happened.
Sorry, are they providing HPC services to your individuals?
I don't have all the details about that, but I can find that out and let you guys know. I know that's what you guys were talking about, but sorry, just.
No, you're fine. You're fine. I was just trying to understand, are they Medicaid providers, or do they just own houses that are individuals live in?
I don't think so.
Okay, got it.
I don't think so.
Okay, all right, cool.
But I just like to say something like, if you receive service from the county board, you know, and it's not like you have to have a waiver service to get that maintenance or that service, you know what I mean? It's like, it's just part of the service that we provide,
Right.
you know? So,
Yeah.
Courtney, it sounds something like, kind of like our Pike Metropolitan. It's
Yeah,
what it
it
sounds
does.
like. It sounds similar to that. And we all work in conjunction with community action too. A lot of our individuals can go get extra funds that may be needed. Community action does a lot of situations. For example, if I have an individual that wants to move out and move into another home and they don't have first month rent and deposit, community action will go ahead and there's grants that they have that they work with our county board to figure that out. So I think that's what Nathan's talking about.
All right, cool. Yeah. Awesome. Well, you know, I think that we can start by, maybe it's just having a conversation with ODOT, our local, you know, regional ODOT hub. I think it's here in Chillicothe. And just talk to them about the wheelchair ramps, you know, on the sidewalks. And then, you know, if you're having an issue at home, it looks like we have at least some avenues to reach out to. Okay, cool. Well, welcome, Lisa. We are the Southern Ohio Advocacy Group. This is not normal. Typically, we meet in Chillicothe and we do big in-person meetings, and we have, you know, 12 counties representatives. So this virtual world has, you know, definitely changed the way we do things and has made our group smaller, but we think more effective. And we've had really good conversations over the last year. And now hopefully 2022, we can make some change. That's kind of our goal. But we are excited that you are here today to talk to us about the Ohio ISP, because we know it's coming in 2022. So you can have the floor for 15 minutes or 45 minutes. Whatever you need to do, just to basically, we just want to know a little bit about it and know kind of when to expect it and what changes, what the difference is going to look like. For our ISP meetings and for our plans, and then maybe just open the floor for questions.
Sure, not a problem. And I'm terribly sorry if I was late. I had 11:30 on my calendar, so I do apologize if I missed something earlier. So
we wondered if that's what it was. No, you are perfectly fine.
Good. I'm sorry about that. Well, I did put together a handful of slides that I'm happy to share and go over with everybody, and hopefully that'll answer some questions that you might have about the Ohio ISP. However, if it doesn't answer your questions, you can either ask during the middle of the presentation or hold your questions till the end. Whatever works best for you. We are a small group, so I'm happy to stop in the middle and answer questions relative to particular slides. The only thing is, once I start sharing my screen, I'm not going to be able to see your guys' faces. So I won't know if somebody has their hand up or is trying to give eye contact, like, hey, Lisa, I got a question. So just feel free, go ahead and interrupt me. It's not gonna throw me a curveball. It will be fine. This is casual information sharing and answering questions. So I want people to feel informed and feel connected and have the ability to ask questions as we go along if you want to, for sure. And one thing I do want to clarify before I get going is, Courtney, it's done. The Ohio ISP is done, right?
Heard that, yes.
It's not coming.
Oh, well, that's true. That's true.
It's there, it's done, and it's available for people to see. If you haven't been talking with your support person at the county board and or ICF, do we have any members of ICF representation on the call today?
I don't think so.
Okay, all right. Well, it is available on our webpage, and you can go look at it, print it off, read it, touch it, smell it, whatever you'd like to do. And we would absolutely be encouraging teams to begin to take a look at it and actually begin implementing it, trying it out.
Great.
Lisa, this is Travis in Pickaway County. I do a lot of our scanning for our office, and I've seen quite a few that have already been used.
Yep.
To conduct next to ISPs.
It's great. That's great. There are a variety.
They're a little longer. I've noticed that.
I think it depends on what county you're coming from, Travis, because for some counties it's way shorter. And for some counties it might feel longer. I can share with you that we've had a variety of different counties sort of crosswalk their old assessment into the new assessment, just to say, like, oh my gosh, I don't feel like we're getting at this question like we used to, or did we forget about this question? And the majority of the county boards are actually seeing, in fact, that all of the questions that they were previously asking really are in the new assessment. The difference is that the new assessment is very much more conversational than it is checkbox. And so some counties are very used to, do you need this? Yes. Do you need this? Yes. And this is really about getting to know Lisa, what Lisa's interested in, and assessing Lisa's needs, versus, let's give an example of saying, already knowing that Lisa's going to go to Easter seals and then skipping that part of daily life an engagement section of the assessment, right? Like we don't want to assess towards a service. We want to assess what people's needs are. And that's just kind of a different way of approaching assessing.
Gotcha.
Cool.
And lots of county boards are actually using it already. So we're very pleased. Hopefully people on the call have had an opportunity to at least see it or have a conversation with your SSA about it.
It amazes me from county to county, because we get a lot of county to county transfers and whatnot, how different ISPs look from county to county.
Very.
To have something that looks similar for everybody is gonna be kind of nice.
Yeah, 88 different ways to be exact, Travis, 88 different ways of planning. So yeah, to have a universal plan that's portable in both county boards and ICFs, because we'd certainly have transfers in between the two settings also, and or to a DC or out, or developmental center and out. So I think that will all be very, very helpful in the long run. So I'm going to share some sort of past information. It's going to feel a little old, but I think what it'll do is it'll sort of level the playing field or conversation field for today, just so everybody's kind of up to snuff about where we've been, and then I'll then take us to where we're at today, and then where we hope to be going forward. Does that sound good?
Yes.
Okay, and like I said, please interrupt me, whatever you'd like to do, but I'm not going to be able to see your faces here in just a couple of seconds.
And I'll try to keep an eye out too.
Great, thank you. My son's dog is in my office. If you hear old school like rock tumbling or rock cleaning that some of you may have had, or I'm showing my age here as a toy as a little kid, that's actually my son's dog underneath my desk that I'm trying to kick desperately to get out. So if it becomes too loud, please let me know.
I said the luxuries of working from home.
Oh boy, oh
Yep.
boy.
Yep.
Okay, here we go.
So Justin, being a new SSA, are you going to learn on the new Ohio ISP, or do you know yet?
I've started going through the training for the new one.
Okay.
I have a feeling I'll learn a little bit of the old, but soon we'll be transitioning into the new with the rest of the staff.
Yeah, cool.
Oh. Okay, here we go. Can everybody see my screen?
Yes.
The Ohio Department of Developmental Disabilities, or DODD, has made a commitment to improve the quality of life for Ohioans with developmental disabilities and their families. To do this, DODD has worked with partners to develop a way to keep the people we serve at the center of the planning process, a way to make sure collaboration between all team members is smooth and simple, and a way to make sure planning services and supports is consistent throughout Ohio. The Ohio Individual Service Plan. One assessment and service plan for all Ohioans who receive developmental disability services.
So I don't know if everybody's had an opportunity to see the video, but that is the logo for the Ohio ISP. So as we move more towards the IT solution, that logo will become more and more important, as that will probably be the logo that you'll see as you would move into the portal, whether it be on the plan author side or whether it be on what we call the community side, which is where people receiving services and family members and providers will log into the system. So we like that little icon. We like the person in the center of it all, and then the people surrounding it, supporting the person to sort of make the wheel go round. So we were very, very happy with where we landed on the logo and the sort of history behind it with the person at the center of it. Oh, we don't want to see that again, do we? Okay. All right, here we go. I'm gonna close my little screen because I see all you guys. So I'm going to minimize you all, which is probably going to take me away too. Okay. All right, so the Ohio ISP sort of began back in 2019, right? And we established an external work group, and we actually had an outside facilitator at that time. And the external work group was made up of a variety of different entities. We had county boards, large and small county boards represented. We had ICF representation. We had families. We had individuals receiving services. We had DSPs. And it was really probably one of the most diverse work groups that I've been on to date while working at the department. And the cool thing about it was that there was absolutely department representation. However, we were not a part of the conversation, if you will. Our direction was to sit along the sidelines and be subject matter experts if in fact the work group had questions around rules and Medicaid and compliance and all of those different areas. There was ODH representation. I know we don't have any ICFs on the call here today, but it is important to know that we began engaging ODH early on in conversation, as this will be a universal plan between settings. And we really were charged, the work group was really charged by Director Davis's initiatives, and he had some core values that he really wanted us to take into consideration as we launched the external work group. And some of those core values consisted of kindness and empathy. He wanted the department to be as transparent as possible. He wanted quality. He wanted inclusiveness, and he also wanted the department to be held accountable for the decisions that they were making related to service delivery going forward. And he had some key guiding principles that he also charged us with around. He wanted to make sure that we landed on something that was simplified. So simplification was extremely important. Standardization, as we've talked about, meaning transferring from one setting to another, one plan, county to county, setting to setting. We certainly want to recognize the ease for DSPs to quickly find information. Like Travis indicated before, about he's just surprised to see how all county boards do business differently. And I'm air quoting here, business, they write plans differently. And so you can imagine if you're a large provider agency and you work in a multitude of counties, the difficulties that creates for DSPs to go from county to county to know where to find important information for the person. And then also he wanted the Ohio ISP, as we've said before, to be portable across the entire state and from setting to setting. And early on, we held some town forums across the state, and we began to gather feedback. We wanted to hear what people's worries were, what people were excited about, and we used all of that feedback to sort of guide conversations that the external work group was having around making sure that we hit all of those noted concern areas, making sure that we used some of those concern areas to drive some of the training that we're developing or that you may have already gone through, and more that we're continuing to develop as we move forward. And we're committed to holding town halls going into 2022. And I'll get to that information later on, but I just didn't want you to think that it was kind of a one and done deal, that you'd only have one opportunity to provide feedback, because it's not true. We're going to be absolutely opening up and going out and meeting with people, whether it be face-to-face or virtually, whatever works best for people, as we have more information about the Ohio ISP. So we developed the assessment and the template. Again, we met with ODH reviewers to make sure that we were meeting all of their tag requirements. And then we developed a tester group. And that people that tested the assessment and plan early on, those were different work members than the external work group. So we wanted to have a separate set of eyes. So if I was a part of developing the assessment, we wanted to see if the questions that were developed were actually able to interpret them and then drive the planning process without really being a part of the conversation as to how we got to those questions, because the questions really needed to stand alone. They really didn't need, or the intent was them for not to have a lot of training early on to be able to implement the assessment, to read the assessment and be able to walk through the assessment. So we didn't want people who were involved in developing those questions part of the testing group. And you can see then in 2020, we began working with our IT solution, so our Salesforce solution. Some of you may have heard about Salesforce, and some of you may have heard, yeah, Lisa, okay, whatever. We still haven't heard or seen the IT solution. That's true. I'm not gonna say that it isn't. We just began last week internal testing, and then we hope to do a little bit of external testing in early December. But the department is committed to not launching forward with the IT solution that isn't ready. And so, although it does put the IT solution further behind, it really is a big commitment to ensure, though, that it meets the needs of everybody in the field. So the department has an IT solution, and then there are a couple of third-party vendors who said that, hey, we'd like to work with the department and come up with our own IT solution. So some county boards who are using, for example, Primary Solutions, they may be using their third-party vendor for the IT solution. However, everything that's entered into the third-party vendor solution must talk to DODD's IT solution, and the plan isn't and doesn't become official until it's actually transmitted to DODD's IT solution. Okay.
But Lisa, is the IT solution basically taking the assessment and putting it into the plan?
It's basically an electronic version of the assessment and plan.
Okay.
And in our IT solution, I cannot talk to third-party vendors, honestly, because I just simply don't know. And it's not that I'm withholding, I just don't know. But in our IT solution, there is a lot of auto-populating that takes place. So if you're going through the assessment and you identify a place where a potential outcome, oh, hey, this assessment information might lead us to a potential outcome for Lisa, you can indicate that. And then when you get through the assessment and get to the planning process, there'll be some information that's auto-populated and reminders so that you don't have to go back to the assessment that, hey, this popped up in the assessment, and revisit it as a potential outcome.
Cool.
Does that make sense?
Yeah.
Okay. All right. Cool. We also began working with a planning group, which was a smaller subset of that external work group that was developed in 2019, just to begin conversation about rollout of the Ohio ISP, what sort of training needs to take place for the Ohio ISP. So we do have a planning subgroup still in place today that we meet with on a monthly basis. And you can see that then also in 2020, development and training. So we updated the Ohio ISP for testing based upon feedback that we received throughout the assessment process. Some tweaks were made to the Ohio ISP. We began to analyze the data that we got, which I'm going to share with you the data that we received during the testing process here in just a couple seconds. And then we developed the overview trainings part 1 and part 2, which hopefully everybody who writes plans or plan authors have had the opportunity to go through those trainings thus far. In 2021, and obviously we're ending 2021, but we developed external resources. We have again, just the continuation of that planning work group, external work groups that we're working with on communication and training. Those are two things that we're working really, really hard on, is making sure that we are communicating clearly from the department about where we stand with the IT solution. There'll be a demo coming in December for anybody who's interested in seeing the IT solution. So be on the lookout for communication from the department about that. You can see that in 2021, I just mentioned that UAT, that's that internal testing that I talked about is happening right now. We've been talking and preparing with ICFs and county boards across the state, helping them develop their implementation plan. We've been holding gatherings over the last handful of months where we've really taken that deeper dive into the assessment and planning process. And now we're actually walking through sections of the assessment at all of the gatherings. And we're pretty much building a plan during these gatherings. So we're taking 2 sections at a time, working through them as a group, answering questions as we go along, and hoping that then this leads support to plan authors as they move forward with implementation. Then we're also developing a plan author manual. The department has a lot of resources already developed, but they're just in a variety of different places and they're not in one central location. And it's just not helpful for SSAs and QIDPs, and we acknowledge that. So we have a group of people who are working on making sure that SSAs and Qs have one place and one manual to go to answer their questions that will be housed on our website. So that sort of gives you a little bit of history about when we started, what was happening through the testing process, and the which takes us again to the current time frame today around internal testing, and then a multitude of county boards and ICFs using the paper version of the Ohio ISP. Any questions about any of that? Okay, I'm going to move along to the next slide. So this is a big slide. It's a little blurry. I apologize. It's a lot of information on this slide right here. But there's 2 pieces of data that I want people to see. So a lot of people, and we heard earlier, I think Travis said, oh, it's really big, right? Really long. And we asked the testers to make sure that they answered every question on the assessment, right? We didn't want any question to be missed because, again, we were testing the questions and we were testing the assessments. And we really wanted to know how long and how many times did people meet to get through the assessment phase of the planning process, because there was a lot of concern early on, just as Travis said, about, hey, this is super duper long. And we wanted people to know that most teams on average met 1.5 times to complete the assessment phase. And again, that was asking every question on the assessment. And it took, on average, teams about 4.5 hours to complete the assessment. So these are some questions that we asked, and this one was specifically geared towards SSAs and QIDPs, but we asked them, does the assessment information clearly lead to the plan? And you can see here that 66%, almost 67% agreed that the assessment information clearly led to plan development, which is, again, something that we were charged with doing. People feeling good about the information they got in the assessment and supporting the planning process.
Lisa, may I ask you a question real quick?
Yeah.
So when I was scanning one of the ISPs, I kind of just took a glance at it to see what it looked like, you know?
Yeah,
and
sure.
I noticed the way we do our ISPs now currently, it's like the first page is, you know, picture of the person and then some information about the person. I didn't see that kind of information until later on in the ISP itself with a picture of the individual.
Correct.
Was that purposely made that way for a reason?
Yes, the external work group wanted that sort of at a glance. Now you can print off, I'll say this, you can sort of print off whatever pieces of paper or sections that you want to print off. So you could go in and just print off that sort of at a glance page,
I
but it
got you.
was pretty purposeful that it was landed more at the end versus the beginning, because people felt like once you made your way through the assessment, you'd be able to automatically fill in the answers to that at a glance page. And they didn't want people starting at the at a glance. They wanted the answers from the assessment to drive that at a glance page.
And then the other thing I noticed is like, on the ones that we are usually using currently here in Pickaway County, I noticed that like it has like, the span dates, when it starts, when it ends.
Mm-hmm.
And it also has at least the person's name on the first front page. I didn't see even a name on the first few pages.
Yeah, you'll like in the electronic form, you'll see all that. And I think that's one of the disadvantages of on paper, right? There isn't a place for you to type in the person's name on the paper, because when you're doing it electronically, it'll all be auto-populated. You'll know that you're working on Lisa's plan. And then when you transmit it to other team members electronically, they'll know whose plan it is.
It took me like, they handed it to me to scan, and I was looking on the first page for like the person's name and the span date, so I could input that into our scanning system that we use. And I had to go further back into it to find out what the span date was and actually who the ISP was for. And it was kind of, it threw me off, I can tell you that. That's a good point. I guarantee you it has to do with the fact that we're using the paper version and not the IT solution currently, because again, all that information will be right in front of your face as you're in the IT solution. But it doesn't help your current situation. Yeah, you do have to flip through those pages to get to the information that you're talking about, Travis. That's for sure. Yeah, absolutely.
That's for sure. Okay. So here we started expanding, asking people, all team members, right? All team members, the next set of questions. And does the plan talk about what makes the person's life happy and keep them healthy? And you can see here that all team members, not 95 of them, was 96% of people who tested the assessment and planning process agreed that the plan talks about what makes the person's life happy and keeps them healthy. And that was really one of the big concerns that we heard from those town halls that I talked about back in 2019. How can a standardized assessment still be person-centered? How can a standardized assessment really talk about, again, person-centeredness? And you'll see here throughout the data that it really is able to get at what's important to and important for the person, for sure.
Who are you getting at? Health department.
Okay. You can see here again, we asked all team members, does the plan talk about health and safety related needs? Yes, there's a whole section in the planning process that talks about health and safety. And then you can also, each section of the assessment has a risk section associated with it. So you can identify if there are any risks in each part of all the 7 domains of the assessment area, which I'll talk about those 7 domains in just a second. Does the plan give a clear and accurate picture of a person? Again, we asked all team members, and you can see 77% of the people who participated in testing agreed that an accurate picture was developed while going through the assessment and planning process or while testing the assessment and plan. Was it easy to work on and finish the plan? 62% of people agreed that it was easy to work on and finish the plan. We did go back and have some individualized questions with people who sort of strongly disagreed with that, because we really wanted to know if we'd missed the mark or how we might go about tweaking our training, sort of kind of help us understand why you strongly disagreed with this. And it is driving part of our training, as I talked about early on.
Lisa, do you think the people that, like the SSAs who strongly disagreed that this was a good plan or an easy plan, are just ones that aren't good with change? Or were there some like major issues that they brought up that?
I think it was really more about moving from a checkbox to a conversational assessment.
Okay.
And we continue to get a lot of questions about what if Lisa doesn't use words to communicate.
Okay.
And so people were struggling with the communication section.
Got it.
So these are sort of, again, I talked about these early on about the direction and the guiding principles that Director Davis charged this work group with around standardizing, streamlining, ensuring that a single service plan could stay person-centered, making sure that it was portable, we simplified, stayed team-focused, and aligns with compliance. And one of the things that I want to talk about, I don't want to spend a ton of time talking about compliance, but if you have compliance questions, I'm happy to answer those also. But I do want people to know that we do have a group of reviewers who have been working with us from the get-go and have been ensuring that the Ohio ISP is in direct alignment with compliance. Because people always ask, that's really great, we love this template, but what do those compliance people say? And we want people to know that they've been with us, they've been along for the ride, they've reviewed the plan, they've crosswalked it into our compliance tool just to ensure that we aren't having any huge gaps in that area. And so this is another sort of area too, I think, that talks about just maybe where some confusion lies or some definite training needs to take place around these sort of four core key responsibilities for plan authors. So assessment, planning, monitoring, and revision, right, is all done through ongoing conversation. And these are really kind of the core responsibilities of the plan author. You can be assessing while you're monitoring. The plan should be always in some sort of revision state, if you will. So we're really moving more towards this ongoing loop versus that one-time annual event. Moving further away from, let's sit down on December 2nd to talk about this past year and next year. Let's really take every opportunity to do a thorough assessment, and that will drive a great plan. Let's make sure that we're doing our monitoring and then making revisions as we go. And all of this happening sort of through ongoing conversation. And you heard me talk earlier about those 7 domains of the assessment. And you can see that these are all the domains or assessment sections. So there's a communication section, an advocacy and engagement section, a safety and security, social and spirituality, daily life and employment, community living, and healthy living. And in each one of those domains, there's an important to section, skills and abilities. You heard me say that each section has a known and likely risk. It talks about level of supervision, what's working, what's not working, outcomes and experiences, and services and supports. So those 7 domains, you're answering and talking to and assessing these different sections on the right side of your screen as you move through the assessment process. Any questions about that? So really ensuring that assessment is driving the planning process. Again, that we're not leaping to services and supports, because that's really what we see a lot is, oh, Lisa wants to go to day program, Lisa wants to go to bowling on Saturdays, as opposed to letting the answers in community living and daily life and employment drive what it is that Lisa's interested in. We have a tendency as an entire field to leap right here to services and supports. Okay, we've had a couple of rule updates since we started this process. I won't spend a lot of time talking about boring rules, but we have had a couple of rule updates and we will continue to have more. We're looking at a single planning rule, hopefully beginning in 2022. We hope to start those conversations. We have regional supports identified to help county boards, ICFs, and providers through this transition. So you can see in Region 4 that we have myself, we have Kelly Fehrenbach. Some of you may know Kelly. She is the regional support facilitator who is earmarked to work directly with county boards in Region 4 and ICFs as they begin to transition to the Ohio ISP. And then we have a compliance manager dedicated to this region too. Her name is Christy Williams. And if you need specific contact information, it's all here, but I respect that it's small to see, so I'd be happy to send contact information to anybody. And then here's sort of kind of a quick sort of summary again, talking about it's coming, right? Fall of 2021, internal and external testing. We're going to start testing the transmission that I talked about from those third-party vendors. Then we're going to start planning and preparing to enter and onboard during the implementation phase, and targeted right now, fall of 2022. And then having everybody be in and up and running fall of 2023. Any questions or comments about that? I will hopefully stop sharing my screen. Come back on camera, and then if anybody has any questions or comments or anything at all, I'm happy to answer or talk, and if I don't know the answer, I'll certainly tell you I don't know. I'm not going to make it up, and I will follow up back with you and get you the answers that you're looking for.
Lisa, this is Travis in Pickaway County. I have a quick question for you. So once this is completely rolled out and everybody's using it like they're supposed to be, and once they're starting to go through this process of, doing ISPs for individuals and whatnot, and they see that there should be a part here that's a part that's either omitted or a part that they think could be added to it, will you guys have a committee that goes through and revises this ISP at certain points or in so many different years?
Yes, we've made a commitment to the external work group not to make changes for the first year. We'll certainly take feedback and keep the feedback. Right. Again, through those town halls that I talked about, those sort of audience specific town halls, but we've tried to stay true to our commitment to the external work group to sort of let the process play out, right? Let people spend a year touching it, smelling it, using it, getting familiar with it before we start doing a variety of changes to it.
Right. I was just saying, if there's going to be a work group after all that happens, if there's going to be a work group that needs to make those changes,
yes,
will you guys meet so often to change it since it's going to be a permanent thing?
You know what? That's a good question. I don't know that we've thought beyond the first year, truthfully. I really don't think we have. I think I know we haven't. I'm sure that I can tell you that typically that's how the department works, right? We typically get an external work group together to help support and drive so that we're not making decisions in a silo, because we're aware that we're not the people on the ground doing the work, right? We need the feedback from the people who are actually doing it. Right. So I'm air quoting here, I'm assuming, but that we'll make ongoing changes, but we haven't really thought beyond just this first year and kind of getting it up and running and staying true to the questions that the external work group developed.
Okay.
Great. Any other questions for Lisa? All right. Well, thank you so much for being here with us and presenting. And I think hopefully in 2022, all of our individuals should go through this new assessment, correct?
Correct. Yep. So SSAs and QIDPs should sort of begin looking at sort of when you might be holding, regular team meetings. And if you sort of follow that timeline, you might want to start sooner rather than later, because you don't want to, you want people to sort of kind of have that year transition, your caseload to have that year transition, knowing on when we all need to be in. You're going to want to get going a little bit sooner rather than later, I think, to meet the timeline.
Absolutely.
I've noticed one thing that's been helpful. I've started it over here in Pike County. I've worked on one right now currently, and we have a couple other SSAs that have completed maybe one or two, and that are working on some right now. And just the conversation, dialogue, that you're gonna find yourself in a lot of situations of not having a book and a pen, just in a car and talking. And just that information is the information that will go into the plan. That's going to be very beneficial. So just find yourself as, like, you know, SSAs. Justin, I know you're a new SSA. You'll find yourself working on these plans, just having conversations with a normal dialogue conversations. And that's the most important information that you'll find that will hit the questions that are being asked in that assessment.
Yeah, that's a great point. Thank you so much for that, because once SSAs and Qs get familiar with the plan, again, which is why we're encouraging people to familiarize yourself with the questions, you're obviously not going to be reading right from the assessment, right? And so you're going to adapt and modify the questions for your audience. So you want to feel comfortable with all the questions that are on the assessment, so that through sort of regular kind of conversation, you can begin hitting all of those key areas, or those 7 domains that I talked about that are in the assessment process.
And even I also noticed too, because it becomes beneficial using all team members too in this situation of, because you want to make it, you know, like you said, Lisa, sitting down and just asking these questions on the list. You're even in the team setting, you're not going to get as in-depth answers as you would personally when you're with the individual one-on-one, or when that individual is with the staff person one-on-one. So don't feel like you can't say, hey, you know, have this conversation with the individual at home. And then that staff, because a lot of times that staff can bring that information to you, and they've got a different piece from a different area and a different domain at home. Makes it very beneficial sometimes, I've noticed.
You are singing my song. Yes, absolutely. Absolutely. Utilize those people that know them the best, right? Be cognizant of the fact that somebody might not want to answer a question about sexuality in a room full of, you know, 5 or 7 people that they see one time a year that isn't even in their space or their home. So be cognizant of those kinds of things. Absolutely.
Awesome. Cool. All right. Well, great. Thank you, Lisa. And I have your contact information. So if anybody else comes up with a question or something, feel free to reach out to me, and I can get a hold of Lisa.
Yeah, please. Anytime, call or email, whichever works best for you. But we're happy to help, and I'm happy to get you connected directly with Kelly. If you want Kelly to come into your county board and do something specific, we can make that happen too. We really do want to support and be accessible and help along the way. So reach out for anything. And I thank you for affording me the time today. I'm sorry that I was potentially late, and I hope I didn't take up too much time, but I appreciate it.
Well, thank you.
You were fine. Okay. We appreciate it. All right. Thank you, Lisa.
Happy Thanksgiving, everybody.
Yes, you too.
Thank you.
Thank you.
Bye.
Bye.
Bye. Okay, great. So yeah, so you guys should all, I think if your county is not currently using the new assessment, they had to choose a month in 2022 that they were going to start using it. So we should all see it coming, if not already, very soon. Let's go ahead and move on with the agenda. I think we're almost done here.
I have a quick question.
Yeah.
Do you have Lisa's contact information? Will you be able to share her contact information? Because I would like to pass it along to one of our SSAs, and maybe they can have her as a guest speaker. Or
Absolutely. Yep.
Thank you.
I will put it right in the chat here for anybody to grab.
Alrighty.
Lisa Alsmeyer, if I'm trying to say it, Alsmeyer.
We found it.
Yep. Okay. So let's talk about, Travis, are you there?
I'm here.
Okay. Do you want to talk a little bit about the transition coordinator mentor program?
Sure. So as you guys know, we've been interested in doing this transition mentoring program for students that are transitioning out of high school into the real world. And what we're trying to do is eventually, get a list of people we can contact in the schools to reach their students if they have questions. So the first part of it is, who is a transition coordinator? And I believe that every county should have some sort of a transition specialist in their office. And you can reach out to them and hopefully they can get you either a meeting with somebody in the schools, each of the high schools in your county, or get you a list of them, and so we can contact them ourselves in our group. But I have, if you guys haven't seen the, Courtney, have you sent out the Google Doc to everybody or no?
No.
Okay, so Courtney and I have created a Google document that eventually we will send out to everybody in the group of transition coordinators in for example, in Pickaway County is where we started. So we got the transition coordinator for the county board there. And then he gave me information for the contacts for transition in each high school. So what we're doing is getting an email address or a phone number, what their title is. And it looks like Courtney, yeah, there we go. So you guys can see it's the name of the person, where they are located, and what school or what county board, what their title is, their phone number, and an email address. And we're wanting to get that for all of the counties that we have represented in our meetings, so that we can get a good database of contacts to reach out to once we want to start this mentor program.
And we are going to try to, we would like this information before the first of the year. So that by the first of the year, we can kind of have a list of Southern Ohio contacts. And currently, Travis is the only one that has done this. So if you guys could just put it on your to-do list here, I know we're all busy. But like Travis said, if you reach out to the one transition coordinator specialist at your county board, they should have contacts for all of their high school transition programs.
Let's just say that list right there took me all of
Hey,
5 to
Travis.
10 minutes to get.
Teresa
So it's
is
really easy.
our transition coordinator.
Say it again, Sherry.
Huh?
Say it again.
Teresa Roland is our transition coordinator.
Okay.
Yes, correct. So Teresa should be on this list. Plus, I'm sure Teresa can get you contact information for people in your high schools as well who may work with the transition programs.
All 11 of them.
All 11 of them. So Sherry,
Hi,
Bill,
Teresa.
or Teresa might just be able to forward that over to us for you guys.
Courtney, you had said to have this information to us by the end of the year. I think if they
Oh,
bring it,
yeah.
because we don't have a meeting in December.
That's right. But
If
you
they
can
have to
email
us-
it.
Yeah, or you can email it to her, but I'd say by the time we have our January meeting, we should have these, take
Yeah.
a list compiled.
Yeah, and what our first January meeting will be, let's see here. January
18th.
18th.
And from what I've heard, I'm not really good at using the Google document. But from what I've heard is that if anybody has the link to that document, at any time you click on that link, you can get in there and you can actually add your own information to it instead of, sending it to Courtney. You can go ahead and just straight add your information to that list. And it updates automatically.
Yeah.
So
I think at this point, Travis, I would feel more comfortable if all the information was just sent to me. I
Okay.
compile it.
Okay.
And then I may just end up sharing that as a PDF format,
work.
so everybody has it, just so that nothing gets deleted. I know Google Docs, you can delete everything and then lose it. So
yeah, absolutely.
But
And
yep,
then the other thing we were wanting to do is form a list of topics that we wanted our individuals in our group to be specialists at when it comes to talking to these transition students. If you guys are called on to speak to a specific student about a specific topic, we think that you guys should have, or that we should have a list of topics and who wants to be part of those topics. So
we don't have to come up with them now. We don't have very many advocates on this meeting today. But it's just something that when we start reaching out to transition coordinators, we need to say, hey, we are Southern Ohio Advocacy Group, and we can talk to you about, or we can mentor your high school students on these topics. We don't want them reaching out to us about just anything, because we want to be able to support them. So, but even if they have something that they like to talk to us about, we can always tell them no, I guess, and try to come up with something. But we want to have a little bit of.
So we need to eventually, come up with a list of topics that would be beneficial to those transition students that they can reach out to us for if they have any questions. So.
Okay.
Anybody have any thoughts or opinions on that?
Maybe. Maybe. If somebody needs is help with getting used to their communication the device I could help with that. Maybe with me, if somebody needs help with getting used to their communication device, I could help with that.
Absolutely.
So I know I'm late because to this party because I've missed a lot of the meetings recently, but are we considering going like a speakers bureau of say, Bill is an expert in communication devices. So is that how we're sort of planning on rolling this out? Or is it by county?
Yeah, we basically would like this to be regional. So even if Highland County has a transition student who, just got a new communication device, that Bill, with this virtual world now, we've learned it. I think this is kind of a new way of, reaching out beyond our county, especially with this regional group. So Bill could actually meet with that transition coordinator and that student and help mentor maybe not be an expert. We may not want to call ourselves experts, but just, a person who is very knowledgeable because we've done it and been there and advocated for ourselves. And that's where Bill would be able to help someone with communication device. We thought Travis with transportation issues, he's been involved with so many different transportation companies. He's become very not an expert, but very knowledgeable on the how-tos and the whatnots and everything.
And Courtney and I have also talked, once we get this list of transitions coordinators in the DD community and in the schools, we were wanting to blast out. We were talking about how we were going to reach out to these people, whether it would be a formal letter that we're going to write and send it out to all these people, or if we're going to do cold calling kind of thing, or how it's best to be done. I like the idea of the letter, but I guess we can ultimately decide that at some point in the
Yep,
future.
and basically nothing, we would just be here we would be available to help transition coordinators if they have students who have, some issues that they need to talk about. And possibly presentations that they would like to be, we have a transition coordinator who would like to have a presentation done on bullying. Is that something that our group could do for high school students? Just advocate presentations in general. Is that something? How to be an advocate, how to be a self-advocate? Is that a presentation that we could do for a high school program? I think so. I think that that's something that we could do as a regional group to help our communities. But Teresa, if you have any question or like thoughts or concerns.
No, I always have thoughts, Courtney.
And we appreciate that. And this is your world. So think about it and maybe we can talk just to kind of get your ideas. Yes, Bill.
What? About? R E L relate relationships D A T dating or even marriage. What about relationships, dating, or even marriage?
Yeah, I think that that's something that, if you and Sherry were willing to talk about and felt that you had enough knowledge to do that and to mentor people, I think that that's something that we could put, on our list of things that transition coordinators could reach out to us about. Absolutely.
Hey, Bill and Sherry. I was a part of an ableism group, and we had a discussion the other day about being disabled and getting married. And I brought your name up in the conversation. And would you guys possibly be willing to do a presentation or a talk to one of my groups that I'm involved with regarding how you guys went through the process?
We could do that.
Okay. I will get with you at some point, Bill, and we'll go over that, okay?
We done. P R E S presentations in the past on S T R U struggle, struggles to get married. We could do that. We done presentations in the past on our struggles to get married.
That would work. I'll get with you at some point, Bill, and we can get something set up, okay? Thank you, sir.
All right, great. Okay, well, it is 12:40, guys. So upcoming events, we have People First of Ohio always meets every first Friday of the month virtually at 10 a.m. All their information is on their website. Does anybody else have any other upcoming events you'd like to talk about or let us know about? I think things are calming down a little bit here with the holidays coming up. Remember, we are not going to have a meeting in December. And we will resume in January, and just stay tuned to your emails and our Facebook page about upcoming meeting information. Plan on the third Tuesday of the month.
I'm going to
for-
meet in person in January.
Right now it's virtual. We
Okay.
haven't decided to return back to in person. But if COVID somehow gets a lot better, in the next month, then maybe we'll discuss it. But right now, just plan on it being virtual.
Okay.
The OACB Winter Conference is the first Wednesday through Friday of December, but there is not an advocacy track. So maybe that'll be in the spring. Okay, if there's not any other upcoming events, Sherry, we'll let you adjourn the meeting.
Well, we're having our People First meeting next month in December. In the month of December, we're having like a gift exchange, so there's something fun that we do in December. So like nothing major, but that's what we have coming up.
Got it. Okay.
Yeah.
Are you guys still virtual?
No, we've been meeting in person.
Oh, cool.
Yeah,
Awesome.
this place we go to is a restaurant, and it's got plenty of room. It's spaced out, pretty
Yeah.
well, and
Nice.
it's wheelchair accessible, and there's plenty of room. And I encourage our group to wear a mask when they
Yeah.
walk in, and do the best they can to social distance and stuff like that. And I also told them that if you don't feel comfortable coming to meet in person, then that is your right. You can stay home if you want to, and then we'll keep you posted. But we've had about 8 to 11 people have been
Yeah.
showing up at monthly meetings.
Great.
But it's still not to where it was before, where we used to have about 18 to 22, 23 people. So
Right.
it's still challenging now. So the numbers are still down right now because of the way things are, so it's
Yeah.
challenging.
I know. It's going to be a challenge. I think either way we go, absolutely. So I think that, yes, if we can figure out a location to where, we can practice social distancing and wearing masks, of course, then we should get back to in person, because I definitely think it would help our numbers.
Of
considering-
course.
Yeah.
But if it gets bad enough, then we will keep up. We will keep in touch with everybody else. And we go virtual. We just keep an eye on the current situation. So
Yeah, it's a good point. Okay, thanks, Nathan. All right, Sherry, Sherry still there?
Sherry messaged me and said she is having trouble hearing today, so I'm not sure.
Okay.
Yeah.
Got it. Travis, you want to, or I'll just do it. Ask for a motion to adjourn the meeting?
Yes. I about to adjourn the meeting,
Sherry, okay, and then do we have a second?
but before I go, I want to wish everybody happy Thanksgiving and a Merry
Oh, thank you.
Yes, absolutely.
Absolutely.
Happy Thanksgiving to you too.
Yep. Absolutely. All right, and do we have a second to adjourn?
I'll second.
Okay, Travis. Great. All right, guys, have a happy Thanksgiving and just stay tuned to your email for updates on our January meeting.
One quick thing.
Oh, yep.
Bye.
See you guys in 2022 on my birthday, by the way.
Ah, yes,
That's
yes.
our next meeting, so.
All right, awesome. See you guys later.
See ya.
Bye.
Bye-bye.
Bye.